Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 8th of October 2022 OET exam. So what was the letter? It was a known case letter, writing a letter to a patient's own GP. So let's move on to the case note. Patient name is Mr. James Grease and his age is 30 years old. And also his diagnosis is suspected to have lung cancer. So the letter is written by an occupational health nurse. The patient where he is working, there he gone to that nurse with the so-and-so symptoms. So thereby the nurse is writing a letter to the patient's GP. Okay, so what is the patient complaints? Let's move on to that. Regarding the social background of the patient is leading an unhealthy lifestyle and also there is no proper diet plan and patient is non-compliant with the medications as the patient was suffering with the indigestion and he was on omeprazole which was prescribed by the patient's GP but the patient is not compliant with that and also patient is overweight and patient is leading a sedentary lifestyle, we can say in a short form. And why the patient is presented to the occupational nurse? Because the patient was suffering with the 4-week history of persistent cough, running nose, shortness of breath and also irritation, throat irritation. So these all are the sore throat. So these all are the complaints. The patient was have been suffering with these symptoms for last 4 weeks and also he is living with his girlfriend. So the girlfriend was suspecting him that he may have a lung cancer. So with that suspicion only, the patient presented to an occupational health nurse to know more about his condition. So thereby the nurse is writing this letter to a patient's GP to find out that what is exactly reason behind his symptoms and what is the diagnosis and for the further treatment and management. Okay. So this is the simple case note and nothing to write more, only the today's presenting history and which has to be written in the body paragraph because social background is not necessary as we know that when you are writing a letter to a patient's own GP and he is already aware about his conditions, social backgrounds and what his past medical history and everything, only he does not know that what happened to the patient today, why the patient is presented to an occupational health nurse and what was the reason behind it. So for that purpose only we are writing this letter to a patient's own GP. Okay, so here the diagnosis is not diagnosed by an occupational health nurse which was diagnosed, which was suspected, we can't say even a diagnosis, it was suspected by his girlfriend who is living with him. Okay, so let's move on to the draft of your letter. So how we can write this letter with the small informations. Okay, so let's move on to it. So as we know that when we are writing a letter to our own GP, it is very important to that we have to mention in the introduction is always I am writing to update the current condition because GP knows about him. We no need to say that he is suffering with so and so things or I am writing to refer, I am writing to refer back. So he didn't refer to us, so to write it as a refer back. It's a thing of like updating his current condition only to his GP. So we can write it in a 2 ways. One is I am writing to update the current health status of Mr. James Grease who requires your further assessment and treatment. He is suspected to have lung cancer by his girlfriend because it was not suspected by the occupational nurse, by his girlfriend. So we are just mentioning in the introduction, just we are giving a clear idea to a reader that what exactly the letter is. Okay, this is one way of writing an introduction. The another way if you want to write, I am writing to update the current health status of Mr. James Grease who is under your general practice, full stop. He is suspected to have lung cancer by his girlfriend and he requires your further assessment and treatment. So this is the second way of writing an introduction. So choice is yours, but the main thing is this diagnosis, like this suspicion made by his girlfriend, not an occupational therapist, it is better to inform it in the introduction itself and better not to write the signs and symptoms in the introduction because this introduction should be always a prominent one. You have to give the clear knowledge regarding the letter in a simple way. So thereby rather than writing a symptoms, for example, who is presented with the coughing and sore throat, instead of writing that kind of introduction, this introduction will make a little bit clearance about your letter. So who is suspected to have lung cancer by his girlfriend, and he requires your further treatment, further assessment and treatment. And then the hint is like, I am writing to update the current health status of Mr. James Grease, who is under your general practice, and he is he is suspected to have lung cancer by his girlfriend, and he requires your further treatment, assessment and treatment. Like this also we can write. I feel like this is the better way of writing rather than involving the signs and symptoms in the introduction. Okay. And next body paragraph, as we know that we are completely omitting the social background, which is not necessary to write it because we are writing to our own GP of the patient. So now coming to the point of present medical history paragraph, that has to be written in two passages, because we are completely eliminating the social background so that we can elaborate it as much as possible of the today's present medical history. Okay, so we can start like this. Always we have to start the second paragraph with the second name of the patient. So his name is Grease. Like that only my students said to me. So if I am wrong, I really apologize for that. So they said to me James Grease. Okay, Mr. Grease presented today with a 4 weeks history of, because he was suffering with these symptoms for last 4 weeks, isn't it? And also he was taking the medications by himself. It was the over-the-counter medications, but that was not helping him at all. That's why after the girlfriend suspicion, and he also was thinking that my medicine also is not helping me, still I'm suffering with the same symptoms and it is getting worse day by day. So it is a time to consult with a nurse. So that's why he came to his workplace where the occupational nurse is working. Okay. So we can start like this. Mr. Grease presented today with a 4-week history of persistent dry and irritant cough, sore throat. And thereby what happened, like the nurse has been examined the patient. So on examination, his vital parameters are normal. However, what happened to the patient? However, patient suffers with severe breathing difficulty and wheezing when walking or on exertion. So his vitals are stable, but still patient is having severe breathing difficulty and wheezing when walking or on exertion. So these things is very important. So we can write Mr. Grease presented with a 4 weeks history of persistent dry, irritant cough and sore throat. Full stop. On examination, his vital signs are stable. However, what happened? He suffers with severe breathing difficulty and wheezing when walking or on exertion. So this is the thing we have to write it. And next thing is, he is just reporting that what he is reporting, which means he was taken the over-the-counter of medications, but the symptoms were still the same and the condition is deteriorating. So he is stating that. So Mr. Grease stated that he had the over-the-counter of medicines, but it is not giving him proper management, or it is not helping him to relieve the symptoms. That thing we have to mention it over there. And then in the second paragraph we are just mentioning it, that as he was on omeprazole for his indigestion, and also he was noted to have severe weight loss to 91 kg, because in his old record the doctor is mentioning that the patient was put on omeprazole for his indigestion, and also he was noted to have a severe weight loss symptoms. So the doctor is already aware about it, but still we have to mention it because the patient is having poor compliance with the medications. That is a very important thing, that where we have to mention it. So the first present medical, after the introduction, the first passage can be written like this. Mr. Grease presented with a 4 weeks history of persistent dry, irritant cough and sore throat. Full stop. On examination, his vital signs are stable. However, he has shortness of breath and wheezing when he is walking and on exertion. So these things are, we have to written it. And then we can write though he had the over-the-counter medication, his symptoms are still the same. His symptoms are still same. Like that we can write it. And then we are coming to the third passage. We can write, Mr. Grease has poor compliance with the medication regimen, especially omeprazole for indigestion. Full stop. And also you can write, in addition to that, he is noted to have severe weight loss to 91 kg. In addition to that, he has severe weight loss to 91 kilogram. So these are the things we have to write it. And then apart from that he stated that he has a running nose, and thin clear mucus with a nasal congestion. So these are the symptoms that he is suffering at the present. And then we are just coming to the recommendation paragraph. So we are just making this all the points as a 2 passages. Until the first passage that we are mentioning that he had a over the counter medication, still his symptoms are persistent. And then the second paragraph, third paragraph onwards, we are just starting Mr. Grease. So Mr. Grease, what happened? Mr. Grease has poor compliance with the medication regimen, especially tablet omeprazole for indigestion. Full stop. In addition to that, he is noted to have severe weight loss to 91 kilogram. And apart from that, apart from that he has a complaint of running nose and thin mucus with a nasal congestion. So these all things has been written in our third paragraph. Now coming to the point of recommendation paragraph. So in the recommendation paragraph, how we can write, it would be greatly appreciated if you could assess, diagnose and treat the patient as you feel appropriate. So thereby we are just completing the recommendation. That's it, because nothing to mention to the doctor to do this test and that test. So rather than that, you can write, it would be greatly appreciated if you could assess, diagnose and treat the patient as you feel appropriate. Instead of writing the patient Mr. Grease, you can write it. And then the conclusion part, please contact me for further details. And then we are just going for, if the doctor's name has given in your letter, you can complete the letter with yours sincerely. If they not given the name of the doctor, you can complete the letter with the faithfully. So it is a very simple letter and also given a very low informations only, but we can make it up to 180 words if you are just elaborately written your present medical history paragraph. Mainly in the introduction, it is important to mention that was suspected by his girlfriend, not by the nurse. Okay, that is very important, rather than writing the symptoms in the introduction. Okay, I hope this letter might given you the best opinion about that how to write this letter. This is just a draft, so we can write it in a different way, but the content is same. Okay, I hope you all have done in a good way, and we are just running the crash course also. Like for the next exam, we know that the next exam is October 22. So whoever else want to join in our class, 10 days writing class or speaking class, and you can join in our class. And also we have a beginners class and 40 days, 60 days and 50 days packages classes also is ongoing. Whomever wants to participate in our join in our class, our number has given in our description. You can contact us at any time. So until then, bye bye.